Hi, my name is Elaine Newell and I'm a diabetes nurse specialist. In this video I'm going to guide you through physical activity for older adults with type 2 diabetes. Being physically active is one of the most important steps that people of all ages can do to improve their health. Physical activity also has many benefits for your diabetes, and these include controlling your blood glucose levels, improving your blood pressure and cholesterol, losing weight and maintaining a healthy weight, improving your circulation, improving your muscle strength, sleeping better at night, improving your mood and reduce depression. Starting physical activity. Getting started can be hard if you're not regularly active, and so it is best to start gradually. Start with 10 minutes or less of activity most days, then gradually increase the amount of time that you are active. Finding something you enjoy helps build physical activity into your lifestyle and becomes part of your routine. There are many small ways to be active throughout the day, and so it is important to know that every activity counts and every minute counts. You can also check with your GP before you start becoming active. They can help you set realistic goals, taking into account your level of fitness, symptoms, and medication. Older adults who are generally fit should try to stay active daily. So in this video, we are going to go through 4 steps. 1. Move more and sit less. 2. Warm up and cool down. 3. Moderate intensity physical activity. 4. Muscle strengthening exercises. Step 1. Move more and sit less throughout the day. It may not sound like much, but breaking up sitting time can make a big difference. It all adds up in a positive way to your overall health. Some light activity you can do to break up sitting time can be moving around your home, stretching, doing daily chores, and walking at a slow pace. Tips to reduce sitting time. Move around during TV advert breaks. Stand and walk while on the phone. Use the stairs as much as possible. Take up hobbies like DIY and gardening. You can set a reminder to move around for 5 minutes every hour or 10 minutes every 2 hours. How many steps should I be aiming for per day? For most people, a personalised goal is the best approach. Firstly, find out how many steps you do daily. Then build gradually, adding 500 more steps per week. You can use a step counter, a pedometer, a fitness tracker, or an app on your phone, or a few examples to track your steps. You can gradually and safely increase your steps or increase your movement by 5 to 10 minutes a week. An activity diary is very useful to set yourself a target to motivate you and keep you on track. 2. Warm up and cool down. Beginning with a warm-up will help prepare your body for the main activity, and a cool down is also important when you are finishing your activity. Here are some warm-up and cool down exercises you can do. Remember, sit or stand tall at the start of each exercise, go at your own pace and breathe normally. Chair march. Hold the sides of the chair. Begin a marching action by raising your right foot and placing it down, and then raising your left foot and placing it down. Find a rhythm that is comfortable for you. Continue for up to 60 seconds. Arm swings. Place your feet flat on the floor directly below your knees. Keep your elbows bent and swing your arms from your shoulder. Move your arms back and forth to a rhythm that is comfortable for you. Continue for up to 60 seconds. Chest stretch. Reach behind you with both arms and aim to hold the back of the chair. Press your chest forwards and upwards until you feel a stretch across your chest. Hold for up to 10 seconds. Repeat 3 times. Arm reaches. Hold the sides of the chair. Keeping your right hand in place, raise the left hand up and reach toward the ceiling and hold for up to 10 seconds. Then slowly lean to the right side. Hold for up to 10 seconds. Return to the center and lower your left arm. Repeat up to 3 times on each side. Body twist. Place your left hand on your right knee and your right hand behind you on the back or the side of the chair. Keeping your back upright, slowly turn your upper body and head towards your right arm. Hold for up to 10 seconds and slowly turn back to starting position. Repeat on the opposite side. Repeat up to 3 times on each side. Leg stretch. Slide forward on the chair and straighten your right leg out in front with your heel to the floor and your toes pointing to the ceiling. Place both hands on your left thigh for balance. Slowly lean forwards while keeping your back straight and chest out. Stop when you feel a comfortable stretch in the back of your right leg. Hold for up to 20 seconds and then repeat on the left leg. Number 3, moderate intensity physical activity. You may have heard that the physical activity recommendations talk about building up to at least 30 minutes of moderate physical activity 5 days a week. This can seem overwhelming for some people, and so the message is to start with 5 to 10 minutes and build this up gradually over a few weeks, going at a pace that is comfortable for you. If you're already doing 30 minutes 5 days a week of physical activity, well done and keep it going. Moderate intensity is when your heart is beating a little faster but not racing. Breathing has increased and you can hold a conversation and you are not out of breath. You feel warm and may sweat a little. Examples of moderate intensity physical activity are brisk walking, dancing, swimming, cycling, climbing the stairs, and even pushing a lawnmower. You can split up your activity in the day. Try a 10-minute brisk walk 3 times a day. So there are many ways that you can become more active, and it's really important that you do an activity that you enjoy and have fun. 4. Muscle strengthening exercises. Along with moderate physical activity, older adults should add strengthening exercises using all major muscle groups, at least twice a week. You can use your body weight and so no special equipment is needed. You can also use light weights, resistant bands, food cans or small bottles of water to make the strengthening exercises more challenging. Muscle strengthening exercises can also be yoga, Pilates, and even gardening such as digging and shoveling. You can do activities that strengthen your muscles on the same or different days as to your moderate intensity physical activity, whatever suits best for you. Here are some exercises that you can do. Bicep curl. Place your hands on your thighs, palms facing up. Bend your right elbow and bring your hand towards your right shoulder and slowly lower back down. Alternate right and left arms or use both at the same time and continue for up to 30 seconds. Repeat up to 5 times. Boxer. Place your fists at shoulder level beneath your chin. Smoothly reach your right arm straight out and slowly bring it back to starting position. Do up to 10 punches on each side. Repeat punching to the side and then straight up toward the ceiling. You can also try this with tins of food, water bottles, or small weights in your hands. Sit to stand. Move forward in the chair and place your feet slightly behind your knees. Lean forward with a straight back and stand up. Use your hands for support if needed, but try to aim towards standing without using your hands. Slowly lower back down into the chair and repeat up to 5 times. Chest row. Start with your feet shoulder width apart, with a slight bend in the knees. Raise both arms directly out in front of you with your palms facing down and form a fist. Pull both arms back towards your body in a rowing motion at the same time, so your elbows are in line with your shoulders. Now push your arms away from your body so they are straight out in front of you, and repeat the movement up to 5 times. Ladder climb. Start with your feet shoulder width apart and arms by your side. Lift your left knee up to hip height and extend your right arm above your head and then lower both. Then lift your right knee up to your hip height and extend your left arm above your head and then lower both. Repeat this movement at a speed suitable for you up to 5 times. Calf raises. Standing or sitting with feet hip width apart, keep legs straight but not locked as you slowly lift heels and rise to tiptoe position, then lower back to floor. Repeat this movement at a speed suitable for you up to 5 times. These muscle strengthening exercises can be done initially using your body weight to strengthen your body slowly and gently. Then you can introduce tins of food, water bottles, small weights, resistant bands, and ankle weights to increase strength. You can repeat the movements up to 5 times. Build up to repeating the movements 10 times. Tracking and monitoring your physical activity is a great way of motivating you to continue it as part of your everyday lifestyle. Set a realistic goal for the week ahead and then record your physical activity daily. This is an example of my physical activity diary. My goal for this week was to do a brisk walk for 30 minutes, 4 days, and do a swim 1 day for 30 minutes. To also do muscle strengthening exercises for 2 days. At the end of the week, I did 150 minutes of moderate intensity physical activity and muscle strengthening exercises for 2 days. Staying safe. Some people with diabetes need to monitor their blood glucose levels before, during, or after physical activity, and this is related to your diabetes medication. If you take insulin as part of your diabetes treatment, you may need to reduce the dose before physical activity or take extra glucose during or after activity. Discuss these scenarios with your doctor or nurse. Discuss with your diabetes doctor or nurse if you have eye, kidney, or heart disease and see if these exercises are suitable for you. Check your feet daily as part of your diabetes care. Only do exercises you are able to do. Maintain good posture while doing each exercise. Keep the exercise movements slow and controlled. Continue to breathe normally. Use appropriate resistance with your dumbbells and resistant bands. Increase the resistance over time as you get stronger. Being active will give you more energy, help you feel rested, and is fun too. Choose activities that you enjoy and work towards building a regular pattern of physical activity into your week. This video also has links if you would like to explore more physical activity resources. If you have any questions, please contact your doctor or nurse, and thank you for watching.